Hi, I am Miss Elizabeth, and I am the lead speech pathologist here at Autumn Oak. And we are so happy that you're scheduling an appointment for an evaluation for your child. You might be wondering, what should you expect that first day? In this video, I'm going to walk you through what you can expect so that you and your child can feel as comfortable as possible. So before you arrive, you'll be sent a questionnaire to fill out. We do recommend getting that filled out before the assessment so that we know what to expect on assessment day. When you arrive, you might be given some additional papers. You'll check in at the front desk, and our front office staff, they will greet you. They might need your insurance card, your ID, and they will just have any other forms that you need to complete. Then you'll be pulled back into the therapy area by one of our amazing clinicians. And we will do some case history interview just to get to know your child a little bit more. We might play with your child a little bit too, just to help them feel more comfortable interacting with us. When we get to the evaluation, it's going to be both formal and informal. So we might be using some standardized tests where they have to point to pictures, they have to say sentences or say certain things. If we're looking at speech sounds, they might have to say, what they see in the picture, and we'll be listening to how they say it. Additionally, we're going to be collecting language sample data to look at what their communication looks like. So you might see us jotting some notes about things your child says or things that they do to communicate with others. Additionally, you might see us play some silly games with our faces where we're looking at how the muscles in their mouth work. So they might get to imitate us and stick out their tongue or do some silly faces. So just so that we see how those muscles are working. We're going to look at how they understand and use language. We're going to look at how they interact socially with us, how they engage in play. And we're going to also look if there's any fluency issues, such as stuttering, to see if that's present. Just know that when we're doing these assessments, there's no passing or failing. This is just us helping us understand what are your child's strengths and what are your child's areas that they need more support in that we can address through speech therapy services if they need it. After the assessment is done, we'll review the results with you. Sometimes there might be a time where the clinician needs to look through the assessments and call you later with the results. However, most of the time we can review the results with you after the session. So after the testing session, we'll pull you back, we'll go through the results and let you know if your child would qualify for services and then what the services will look like. We know that every child is unique and every journey is different. An evaluation is simply the first step to understanding what we can do to support your child's communication. And we are so honored to be a part of this journey for you and your child. If you're ready to schedule an evaluation or you want to learn more, please visit us at www.speechhearingtherapy.com. We're here for you and your child every step of the way.